Diabetes is a chronic medical condition in which the body is unable to properly regulate blood glucose sugar levels, leading to high blood sugar. The condition occurs either when the body doesn't produce enough insulin, a hormone that regulates blood sugar, or when the body is unable to use insulin effectively. Over time, elevated blood sugar levels can cause serious health problems, including damage to the heart, blood vessels, kidneys, eyes, and nerves. Types of diabetes. There are several types of diabetes, with the three main ones being Type 1 diabetes, an autoimmune condition in which the body's immune system attacks and destroys insulin-producing beta cells in the pancreas. It usually develops in childhood or adolescence, but it can occur in adults. People with type 1 diabetes must take insulin injections or use an insulin pump for life. Causes. Exact cause unknown, but genetics and environmental factors like viral infections are thought to play a role. Type 2 diabetes. The most common form of diabetes, often developing in adulthood, but it is becoming more common in younger people due to rising obesity rates. In type 2 diabetes, the body either becomes resistant to insulin or doesn't produce enough insulin to maintain normal blood sugar levels. Causes. Lifestyle factors, such as being overweight, lack of physical activity, and a poor diet, combined with genetics, play a significant role. Gestational diabetes. A form of diabetes that occurs during pregnancy in women who previously did not have diabetes. It usually goes away after the baby is born, but it increases the mother's risk of developing type 2 diabetes later in life. Causes. Hormonal changes during pregnancy can make cells less responsive to insulin. Less common types of diabetes. Maturity onset diabetes of the young, MODY, the rare genetic form of diabetes, usually diagnosed in adolescents and young adults. Secondary diabetes. Diabetes that develops due to another medical condition, such as pancreatic disease, or as a side effect of certain medications, such as corticosteroids. Symptoms of diabetes. While symptoms may vary depending on the type of diabetes, common symptoms include increased thirst, frequent urination, excessive hunger, unexplained weight loss, more common in type 1 diabetes, fatigue, blurred vision, slow healing sores or frequent infections, numbness or tingling in the hands or feet, more common in type 2 diabetes. In type 1 diabetes, symptoms tend to develop rapidly, often over a few weeks, whereas in type 2 diabetes, symptoms can develop slowly and may go unnoticed for years. Causes of diabetes. The causes of diabetes vary depending on the type, but common factors include type 1 diabetes, an autoimmune reaction that destroys insulin-producing cells in the pancreas. Genetic predisposition and environmental triggers like viral infections may contribute. Type 2 diabetes. Insulin resistance. Cells become resistant to the action of insulin. Pancreatic dysfunction. The pancreas may not produce enough insulin. Risk factors include being overweight, lack of physical activity, poor diet, family history of diabetes, age, and ethnicity, e.g., higher prevalence in African, Hispanic, Asian, and indigenous populations. Gestational diabetes. Caused by hormonal changes during pregnancy that reduce insulin sensitivity. Risk factors include obesity, advanced maternal age, and a family history of diabetes. Complications of diabetes. Uncontrolled diabetes can lead to a variety of serious complications. Cardiovascular disease. Diabetes increases the risk of heart disease, stroke, and hypertension. High blood pressure, nerve damage, neuropathy. Prolonged high blood sugar can damage nerves, leading to tingling, pain, or loss of sensation, particularly in the feet. Severe cases may lead to amputations due to infections in the extremities. Kidney damage, nephropathy. Diabetes can damage the kidneys, leading to kidney failure or the need for dialysis. Eye damage, retinopathy. Diabetes can damage the blood vessels in the retina, potentially causing blindness. Increases the risk of cataracts and glaucoma. Foot damage. Poor circulation and nerve damage can lead to foot ulcers and infections, sometimes requiring amputation. Skin conditions. Diabetes makes individuals more susceptible to bacterial and fungal infections. Hearing impairment. Diabetes has been linked to hearing problems. Alzheimer's disease. Type 2 diabetes may increase the risk of Alzheimer's disease and other forms of dementia. Diagnosis of diabetes. Diabetes is diagnosed using several types of blood tests that measure blood glucose levels. Fasting blood glucose test measures blood sugar after fasting for at least 8 hours. A fasting blood sugar level of 126 mg/dl 7.0 mol/liter or higher on two separate tests indicates diabetes. A1C test. Glycated hemoglobin test measures average blood sugar levels over the past 2 to 3 months. An A1C level of 6.5% or higher indicates diabetes. Oral glucose tolerance test OGTT. Blood sugar is measured before and after drinking a sugary solution. A 2-hour blood sugar level of 200 mg/dl 11.1 mol/liter or higher indicates diabetes. Random blood sugar test. Blood sugar is measured at any time, regardless of fasting. A level of 200 mg/dl 11.1 mol/liter or higher indicates diabetes. Management of diabetes. Managing diabetes involves a combination of lifestyle changes, medications, and regular monitoring. The goals are to control blood sugar levels, prevent complications, and improve overall health. Lifestyle changes. Healthy eating. A diet rich in whole grains, lean proteins, vegetables, and fruits is essential. Carbohydrate intake must be carefully managed. Physical activity. Regular exercise helps control blood sugar, improve insulin sensitivity, and maintain a healthy weight. Weight management. Losing excess weight can improve blood sugar control, especially in type 2 diabetes. Medications. Insulin, required for type 1 diabetes and sometimes for type 2 diabetes if blood sugar levels are not well controlled with oral medications. Types of insulin include rapid-acting, long-acting, and intermediate-acting insulin. Oral medications, commonly used in type 2 diabetes to help the body use insulin more effectively or stimulate insulin production. Metformin, helps reduce glucose production by the liver and improves insulin sensitivity. Sulfonylureas, stimulate the pancreas to release more insulin. SGLT2 inhibitors, help the kidneys excrete excess glucose in the urine. DPP-4 inhibitors, help prolong the action of hormones that stimulate insulin production. GLP-1 receptor agonists, help lower blood sugar and promote weight loss. Monitoring. Blood sugar monitoring. Regular blood glucose testing is crucial for managing diabetes, especially for individuals on insulin. Continuous glucose monitors (CGMs) devices that provide real-time readings of blood glucose levels, helping to prevent dangerous highs and lows. HbA1c monitoring. Regular A1C tests typically every 3 to 6 months to monitor long-term glucose control. Foot care. Proper foot care is crucial to prevent infections and ulcers. Regular foot inspections, proper footwear, and prompt treatment of injuries are essential. Managing comorbidities. Diabetes often coexists with other conditions like hypertension and high cholesterol, which require careful management to prevent complications. Prevention of type 2 diabetes. Type 1 diabetes cannot be prevented, but type 2 diabetes and gestational diabetes can often be delayed or prevented by maintaining a healthy weight, staying physically active, eating a balanced diet, avoiding smoking and reducing alcohol intake, managing stress and getting regular health check UPS. Conclusion. Diabetes is a lifelong condition that requires continuous management. While it can lead to serious complications if left untreated, proper management, including lifestyle changes and medication, can significantly reduce the risk of complications and improve quality of life. Early diagnosis and consistent care are crucial to preventing the progression of the disease and ensuring overall well-being.